Hey to all our listeners, this is the Proactive Podcast here in downtown Calgary. My name's Dr. Matthew Jurgis. I'm a chiropractor here. With me is chiropractor and powerlifting enthusiast Dr. Alex Fitzowich.
Yes, sir. How's it going?
Good. And we have Naturopathic Doctor, sleep and mental health specialist Dr. Ludovic Brunel.
Hi, thank you for having me again today.
Absolutely. All right. So he is our newest addition to the Proactive Health Group team. So it's been awesome having him so far. He just really fits the team perfectly. So it's good. All right. So today we're tackling mental health issues. This is a specific interest of yours, and a lot of people don't really know to what extent a naturopath can help in this field and what kind of role you guys can actually play in improving someone's mental health. So what does that look like?
Yeah, so mental health is a growing concern, especially in the last couple of years with COVID. We've really seen that a lot of people have been suffering and struggling more when it comes to mental health. There's lots of things that naturopathic doctors can offer when it comes to supporting mental health. With mental health, lifestyle is key. So things like exercise are usually very helpful, getting proper sleep. And there's lots of supplements too that can really help to improve neurotransmitter function. So when we're looking at improving mood, lots of different options that can be offered by naturopathic doctors.
Yeah, and I think that's why you guys are such suited health practitioners. Of course, a psychotherapist plays a role in all this, but as a naturopath, you guys are well known for your ability to hit things comprehensively. This is a complex issue. There's many moving parts. It's going to be sleep. It's going to be physical exercise. It's going to be diet. It's going to be supplements, everything. And having an expert that can pull that all together is really vital.
Agreed, yeah. So looking at the, everything that's going on for that person is usually key in terms of understanding why they're struggling. So yeah, and a big problem is that a lot of people don't even know that they're suffering from those conditions, and so often simply screening is going to be one of the most important steps, because otherwise it's hard to know who has real issues versus, like if we look at depression, for instance, some sadness is a normal part of life, but it can be tricky to identify the people that are really struggling and need more support.
Right. Okay. So how would you go about that? How do you really screen?
It depends what we're looking at. Of course, there's screeners, so there's simple tests that can be used to assess where a person's at when it comes to mental health. One that's often used for anxiety is called the GAD-7, so it screens 7 questions that basically gives you an idea of how much anxiety the person is under or experiencing. Same with depression, the PHQ-9 is typically the test that's used there. 9 questions just looking at problems with depression. There's also key signs. So typically with depression, the 2 key signs that someone is suffering from depression is that there's no motivation to do things they would normally enjoy. And there's lots of sadness, and men can sometimes have more impatience or become more short-tempered when they suffer from depression. With anxiety, typically it starts to reflect in sleep, and often people will know. They really experience that fear, and they just know they're not in a good headspace. So yeah, just talking to the patient, of course, can help us understand if they're suffering from a mental health problem, but some of those quick tests are very helpful as well.
Yeah, especially because you mentioned some things that people don't always view as the typical anxiety or depression disorder, right? Maybe feeling a little more frustrated in your day-to-day life, or you have these angry spurts that come out. Sometimes people have a hard time characterizing that as an external problem versus an internal problem.
I think there's a lot of factors that are at play. One of the main ones is that there's taboo around mental health, and so a lot of people don't want people to know that they suffer from depression. It's seen as a sign of weakness or that you're not coping well. Lots of patients, for instance, will say that they don't want it in their chart, that they're on an antidepressant, for instance. So that's one of the main problems we see, and unfortunately it leads to a lot of people not seeking treatment when they really need it. And if we look at anxiety, for example, only a third of Canadians that are suffering from severe levels of anxiety are getting any help for it.
Right.
So that's one of the major problems we see.
Interesting. So do you think that COVID has changed that social view at all? Obviously, there's tons of mental health problems that it have come forth because of COVID, and we'll definitely get into that. But I think there's kind of been a societal shift where it's like, hey, we all have mental health issues right now, and that's kind of breaking down some of the barriers. Am I wrong?
I think you're right. There's more awareness. Everybody knows that isolation really increases the risk of having a mood or mental health problem. It's one of the basic principles of psychology that if you isolate someone for long enough, they'll eventually break down. And so with what happened in the last 2 years, mental health problems have really increased. So yeah, I think you're right. The awareness has increased, but a lot of people are still not getting treatment. And with COVID, I think overall, people seeking treatment decreased, right? Like we all heard of people not going to the hospital that were having significant acute problems, never mind chronic health conditions like depression and anxiety. But yeah, isolation is a big problem. One of the key things that we see in the literature when it comes to mental health is that your community plays a huge role in terms of protecting you from having those issues. And of course, as soon as you're isolated, all that support is gone, and then you don't feel like you have that safety net quite like the way you would have if you were surrounded by people who can lend a helping hand if you need help. And that creates more stress and leads to more problems with anxiety, depression, poor sleep, just breakdown in mental health overall. So yeah, we've had lots of problems the last 2 years because of the effect of isolation on how we feel. And that's one of the first things that I think as a society we have to look at. Like, why is it that 30% of the working adults in Canada experience high levels of stress and anxiety every 2 weeks? It's very high. It's becoming it's another pandemic basically. A lot of us are living in constant fear or constant sadness, and that's really not great. And one of the things that we see is if people are nicer to each other, then the rates in the community as a whole go down. So one of the ways you can protect yourself is to lend a helping hand to others. Not only does it help those people, but when you help others, you get that warm, fuzzy feeling, and it really decreases your chance of suffering from depression and anxiety. But it also creates that social network that we really need when it comes to preventing anxiety. So some of the patients that I see that are the most resilient to mental health issues are very close-knit communities. Either they're very active in their church or in their community or in their family. And so those people know that if they need help, there's plenty of help to go around. And if others need help, they're also there to help them. And having that security really decreases the risk of struggling in terms of mood and mental health.
It's really interesting with the isolation, like the experiment that I always use. You guys have probably heard something similar in the past, but you take a lab rat and you isolate them, you put them in a cage, and then you have like the Skinner box set up where they can press a lever, get whatever it is they're testing. And so the original one was either cocaine or it was sugar, like processed sugar. And so when they're doing this test on these rats, they literally like the cocaine or they like the sugar so much that they'll press the button until they die. That's all they do. They just do cocaine, they forget to eat, they die. And so for years and years and years, that was very interesting to see how the neurological wiring of mammals and rats in particular kind of worked along that kind of premise, but it was really only half of the experiment because those rats were in isolation. They couldn't socialize, they couldn't do normal rat stuff, And so they're like, well, might as well do cocaine, might as well do it so much that I die, basically. So
Yeah.
the actual experiment, the other half of the experiment, where all the other rats were when they weren't doing the experiment, they called it Rat Park. And it was basically like an amusement park full of rats. There was tons of them. There was little like games, there was toys, there was food, like there was literally everything that you'd ever need. And they found that if you introduced the cocaine or the refined sugar or whatever it was in that cage environment in Rat Park, all the rats ignored it. They like could not care less. They wanted to wrestle with other rats, they wanted to eat, they wanted to like just live and do whatever their life was, and the cocaine didn't have the same impact. And so with people, it's like, it's not only the external environment that they're in, but their internal environment within that environment as well, right? Like if you're, if you're in a good place, if you're with your church group and your family or like any of these support systems, you really feel that you're being supported at all times. And so you don't worry about little setbacks or you don't worry about this and that, and you can be much more resilient as a group. Whereas as soon as you get put into that isolation, all that goes away, right? It's just you on your own kind of thing.
Right, and that's when you feel that need to lean on these addictive
Or whatever,
substances,
yeah.
as seen in rats, right? If they have a good life, they don't feel the need to indulge in that kind of stuff. That actually reminded me of another interesting study on how people kind of revert back to their old way of destructive ways of thinking. Also to do with rats in a box. They had a rat in a box and they would electrocute him in this box every so often, right? Obviously very distressing, but what they found is after this rat became comfortable with this box as its local environment, they opened the door and let it explore, right? They found that even though this box was a dangerous, damaging place, electrocuting him, when that rat came upon, unknown territory, when it left its comfort zone, when it was scared, it would still run back into this box even though it got electrocuted every time it did. So even though it was painful and this is what it should be trying to avoid, that was his comfort zone, so it came back every time. And you'll find people that have mental health issues still run back to these pathological ways of thinking or these dependencies because it's become their comfort zone. So it's changing what's the comfort zone. That's really important.
For sure, yeah. I think we see that both of those are good examples of, both of the experiments are good example of what happens in humans. And so once you've had depression, for example, you're much more likely to suffer from it again. And so, once you've established there's neural pathways, it can take quite a bit of work to start changing them. And it's the same with isolation for humans, obviously. The more isolated you are, the more likely you are to have problems. As soon as you have a mental health problem, whether it's anxiety or depression, the risks of substance abuse significantly increase. And so substance abuse is closely linked to mental health, obviously.
Yeah. So can you tell us a little more about, you already have, but how isolation really tears us apart? You mentioned something prior to the podcast about how it's actually, illegal, or they're no longer doing it in prison settings because
it's not humane anymore.
It's inhumane, right?
Yeah. So isolation really affects mood very significantly. We're all social animals. And so your resilience as a group is far greater than as an individual. And that's basically what it comes down to. So if you cut someone off from all social interaction, resilience is really affected. And that saying that when the wind blows and the wind howls and the snow blows, the pack survives, the lone wolf does not, is very true. If you do not have that social support system, risk of anxiety, depression, poor coping, substance abuse all increases very dramatically. So one of the things we're expecting because of COVID is a wave of mental health problems, just because we've all been fairly isolated for a long time now.
Yeah.
That's interesting that you talk about coping mechanisms specifically because I feel like you know, you look at some people in their lives, like let's say they're like a Navy SEAL or something, and their stress level is absolutely through the roof. You're like, how could somebody ever survive that? How could they ever sustain that stress? Well, they have coping mechanisms, they have groups that support them, they have, you know, their fellow guys that they serve with, like they have all this excess capacity to cope and to be able to deal with any stress. And a lot of those guys can deal with even more stress. Like they're good. They're so far from, you know, abusing substances or being isolated or whatever. Like they almost have an infinite capacity to deal with stress. And then you flip that all the way around and, you know, everyone knows somebody that seems like they get stressed out by everything. And you're kind of just like, hey, this is not an accurate response. Like you need to turn this down. This isn't that big of a deal. And for them, it's just because they don't have coping mechanisms. You know, like if you look at, it might be a dumb example, but something like a baby, anything that they deal with is like the worst thing that they've ever dealt with, right?
For sure.
And that's why, I at least believe that's why they cry. That's why their nervous system is so like finely tuned, because everything is just too much for them. They don't have any coping mechanisms whatsoever. And so what we want to do is make people stronger, more resilient, better to cope with healthy mechanisms like exercise, sleep, all that, rather than turning to, you know, drugs, alcohol, whatever else kind of thing it is.
Yeah, I think the military is a great example of how, you know, that group really helps to support the individual. And the military has understood this quite well. So it's all about supporting each other, right? Like no man gets left behind. And so in situations of incredible stress, those soldiers know that there's a whole group supporting them. And they also know that they have to support the group. And
Right.
so it allows them to cope a lot better. Having said that, it's, you know, mental health is not all about having a group and having a community, although it's a vital part of protecting mental health. There's lots of things we can do individually as well. So things like exercise or what I would call contemplative practices like meditation, where you're trying to recognize thought patterns that are harmful or unhelpful and really be critical of those thought patterns. That will bring more resiliency to the individual. So there's obviously, you know, there's both things as a community and as a society that we should do better, but there's also lots of room for improvement on an individual level, absolutely.
Yeah, absolutely. And especially with the kind of tech age, I think that a lot of people are looking to the wrong coping mechanisms as far as like a technological supplement to getting that authentic community or
Yeah, so what we've seen with COVID is more and more use of technology to stay in touch. And, you know, having a video chat or a video call with someone is definitely not the same as being in the same room as that person. But it, you know, since it was the best option available with what was going on with the pandemic, I think for a lot of people it was helpful. But what I see more and more is that those people that are working from home, always on the computer, their mental health has suffered. And so I see lots of patients that they cannot wait to go back in an office, to be surrounded by other people, to not have to call someone if there's something that needs to be discussed. Like I think in terms of productivity is another problem for some people, like not being close to each other where you can interact and problem solve together. But yeah, isolation is a big problem, and I think also always being in the same space. And we've talked about this when it came to sleep, right? Like if you're working from home and never leaving your house, then it can become a problem for all kinds of things, including anxiety, sleep, and depression.
Yeah, and we talked about that in the sleep podcast there, where it's like, you know, your room can be your place to rest, your peaceful, happy place where you sleep, or you can collide that with, this is my anxious, stress workplace, and people maybe don't recognize how much your subconscious cues come in when you're in an environment like that.
For sure.
Do you have any suggestions, considering we are on the tail end of COVID and, you know, people are still kind of hesitant to get together, be back in the office, all that kind of thing. Is it better to do Zoom calls because you get to see people face to face, you get to do some, see some body language, that kind of stuff? Is it, like, what would be the best short-term solution for the next month kind of thing while this winds down?
Yeah, it's like foster healthy relationships is basically what it comes down to, you can call people, obviously if you see them, usually you feel closer to them than if it's only audio, so typically that's better. It depends on personal choice though, but yeah, if you feel isolated, it's time to connect with, people you haven't talked to in a while, or join activities or groups where you can meet other people that have similar interest. But yeah, isolation is a major problem, and there's no doubt that isolation leads to breakdown in mental health. And so if someone's feeling isolated, typically I'll tell them, try to see family or extend your bubble to people that you feel comfortable with, people that have had their vaccines. Sometimes I tell them, try to find somebody else that's also vaccinated to decrease the risk if you want more personal interaction. I have some patients that just sit by a busy pathway, and just being surrounded by people, even if they're not talking to them, really helps them. But yeah, we're social animals. We need other people in our lives, and most of us have been deprived of that now for some time, and it's taken a toll, there's no doubt.
It's funny that you say that. Having patients just like sit on a bench in the park, and you don't even talk to anybody, or you don't even do anything, like you just see that other people are around. Like I'm the exact same way, both in the gym and when I go for a walk. Usually I'm like kind of quiet, I'm not really, I'm chatting but not really going out of my way to talk to anybody. And especially these last 2 weeks that gyms have been open, I've been like talking to everybody, like just like even just like looking at everybody, being like, hey, like I remember you, like all that kind of stuff. It's funny, like the impact it has just to see other people around.
Yeah.
Even if you're not doing anything, just being like, oh yeah, he's over there.
Totally. I was just gonna mention, like, even just being in a park,
Yeah.
seeing that other people went to the park.
Yeah, exactly.
Somehow
right?
you're like, kind of feel better. Like,
Yeah.
other people have lives and are able to enjoy them.
Yeah.
Exactly.
Just exercising too is another thing, right? Like as soon as you exercise, mental health is better. If you're fitter, your capacity to resist stressful events increases. So that's another thing that I was telling patients again and again, you need to exercise. But with COVID, the gyms closed, the exercise class was no longer being given. And people tried different ways of adapting the exercise program, but watching TV, doing a yoga class on TV is just not the same as going to a class with other people.
Yeah.
And I think another hurdle that we have to overcome now is to get these people back into the exercise programs, getting these kids back into their activity, hockey, soccer. And I really hope that goes well, because we need it, and without it, health suffers, both physical health and mental health. And yeah, I think COVID's taken a huge toll on our health as a society overall.
Yeah, I love to quote this, but based on what we were taught in school, at the very least, is there isn't a drug on the market that works as effectively as exercise in terms of improving depression and anxiety.
Yeah, there's no doubt about that.
Like science, statistically.
Yeah, obviously, most of my patients, if they suffer from depression and anxiety, I can get them to exercise about an hour a day, high intensity exercise. Things turn around very quickly. The problem is when they can't do that, there's other strategies. Like I usually work with a talk therapist, someone that can, help in terms of recognizing healthy and unhealthy thought patterns, giving patients better coping strategies. But exercise for mood and mental health is really, really important. There's no doubt.
It's interesting because going into COVID, 15 months ago now or whatever, I looked at this as the perfect opportunity for a lot of people to finally get like healthy and fit, because it's a shame that all the gyms closed down and everything like that. But if those had stayed open and people are now working from home, their kids are home, like all these other kind of excuses are removed, I was really hoping that a lot of people, this is when they would really get into fitness and exercise. And it's kind of happened because, you can't do the gyms, can't do the classes. But the other bonus is that people are starting to exercise outside more, and even that alone, just being outside, being in nature, if you're over like in any of the parks downtown,
Yeah.
even just having sunshine, vitamin D, all of that, like tremendously helps you out, even independent of the exercise. So once you have both those together, like really that's probably the best thing you can do during COVID is like go exercise outside, something like that.
It's true, and I've seen a lot of people outside, even through the fall or the winter, tons of people at the skating rink, sledding, and then now we're seeing a lot of people on the bike paths and all that, and it's great to see it.
Yeah, I agree. I see more people outside for sure, but I would say overall, the amount of people exercising, from what I see in practice, has gone down.
Yeah, I agree.
Yeah.
I also agree.
Yeah, people have gained weight, are not exercising as much, and
Yeah.
there's a lot of mood problems. I've never seen so many simply because of that combined effect: less exercise, more stress, and just feeling isolated overall. It's not a great trifecta when it comes to feeling great mentally.
No.
Yeah.
Yeah.
It's such a like positive feedback loop too, though. That's the thing is, we were talking about how once you get into all these things, these healthy habits, it becomes easier and easier. But like in the very beginning, especially if your gym has just closed and maybe you're having some more beers and your job is more stressful and now you're working from home and now your kids are home, like all of those things come together to make it harder and harder. And as soon as you can start, because you're like, oh, well, maybe I won't work out today. Maybe I'll just watch Netflix, and maybe I'll have a beer, and maybe I'll have some chips, and like all of these things just come together. And as soon as we can kind of reverse those and get one of those healthy habits back in there, start working it the other way, people do find it's easier and easier to get back into it. But it's just such an uphill climb from a month of a year of no progress, basically.
Yeah, it's a momentum thing,
Yeah.
and I always kind of describe exercise as like a great mental reset. It can kind of escape you from that headspace or ruminating or just that negative area of thought, and it kind of feels like you're given a clean slate after you leave the gym or after you finish your walk or whatever it may be, and just can kind of press the restart button on your mental state.
I agree. I think for stress management, exercise is one of the best strategies, and stress is, it comes down to it, one of the bigger problems that then leads to these problems like anxiety and depression. And Canadians are very stressed. Like if we look at stress levels in Canada, the workforce, 30% of the workforce is reporting very high levels of stress at least once every 2 weeks. So we know that it's a major problem for a lot of people, and you're right, exercise usually, can help deal with that quite well.
Especially in a time where productivity is going up, which is a good thing, but that also means there's more things on your list. There's more to-do list, right? There's more expectations.
You're totally right about that. So a lot of people feel overwhelmed, and that's where a lot of the anxiety starts to kick in. So one of the important coping strategies for people that have problem with stress and anxiety is better time management. So being able to say no so that you don't end up overstretched and stressed to the max because you've taken on more than you actually can do, which is a common problem. Yeah.
Right. Just writing things down, be better organization.
Yeah, and don't take on projects that you realistically don't have the resources to complete.
Right.
Yeah.
Yeah.
So, having that balance is important.
Right.
Yeah.
Gotcha. So another kind of area of interest, something that really interests me, is mental health and how that affects pain perception and a potential prognosis for a patient. Can you speak to that at all?
Yeah, so when we look at pain is one of the most stressful things you can experience in life, and so if the person is already maxed out, like there's already depression, anxiety, and then you add pain, and the coping becomes more and more difficult, and often those patients will experience more pain because of that. But it can also go the other way. Chronic pain is one of the main risk factors for depression, obviously. So typically anyone that's in chronic pain needs more support because if you're in chronic pain, mental health suffers.
Yeah, and I'm glad you brought that up, that it's a two-way street. You can go top down, your perception of pain worsens the pain, right? You emphasize, your attention is on, oh, this is so painful, and that actually makes the pain physically feel worse. Whereas also, coping with long-term pain obviously is gonna affect your mental state, and other areas of life start to deteriorate with that. So it can go either way.
Yeah, pain obviously takes a huge burden, and so people are usually gonna start struggling when it comes to coping with anything else if they're in chronic pain. And pain also starts to affect sleep, and of course, you don't sleep well. One of the main risk factors for depression is improper sleep. And so it's a slippery slope. Very quickly, someone that's in chronic pain will often end up with other problems related to mental health.
Well, they're just so closely tied together, right? Like if somebody's had lower back pain for 20 years, at the very beginning, yeah, the pain was painful and that was an issue, but you could almost argue it's like a completely different complaint at this point, 20 years later. Like they've been anxious and possibly depressed about having this debilitating lower back condition, they are in constant pain, they can't sleep, and then kind of the next step of that is really a lot more of the mental health effects, right? Where you basically believe that you're never going to get better. You start like refusing to think that treatments are going to work. You don't have confidence in other people helping you out. Like it really just is a slippery slope going downhill, and it's I almost don't blame them because a lot of times it's easy to be like, okay, well, my back's hurt every day for 20 years. It's gonna hurt tomorrow, and it's gonna hurt until the day I die.
I see that with mental health all the time too, where someone's been suffering with something like depression or poor sleep, and they're reluctant to get help. But you're right. If the longer you wait, the harder it usually becomes to fix the problem. So. It's important to seek help because otherwise, things can progress, and sometimes it goes even further than that. Then it starts affecting their personal relationships, and then work, and then everything snowballs. And next thing you know, we have a very serious problem on our hands that could have been addressed a lot easier if we dealt with the initial pain or the crisis that led to depression or anxiety and gave that person better coping strategies from the get-go.
Yeah.
One of the biggest problems I see with mental health is that people are always reluctant to seek counseling. And that's always very hard for me to understand because, you have this problem. Why, when you see an expert that can help you through that problem? But I find there's still a very significant percentage of patients that are not willing to go down that route for one reason or the other. But if we look at literature, cognitive behavioral therapy is going to be one of the most effective ways of addressing mental health concerns. And so typically with anything else that we're doing, that should be a component. So, sure, you want to eat better, you want to take time for rest, you want to look at your schedule and make sure that you're not committing to more than what you can handle. You want to foster healthier relationships. But yes, getting some form of talk therapy usually is going to help quite a bit when it comes to having healthier thought patterns.
Yeah, and especially like early on too in the progression, right? Like that same hypothetical patient, if we had met him 20 years ago when he had an acute back injury, and you could say like, hey, this is what's going on, this is how we're going to fix you, you're going to go see Dr. Ludo, and he's going to explain to you why this isn't the end of the world, why you're not going to be in pain your whole life, you're going to be sleeping better, all these different things, because we also see that patient too. We see patients come in that have a serious injury or a chronic, injury, something that's long term, and they're almost like excited to get it dealt with. They want to get better. They want to start doing exercises. Dr. Matt, you probably get this all the time, but people will say, this hurts, but it's a good hurt because I know it's going to feel better. Mm-hmm. If you already have a very negative outset of your treatment and you don't think it's going to work, as soon as we start getting in there and getting those tissues irritated, that's going to feel horrible. You're going to feel bad. Your depression, anxiety might go up. Like that stimulus is interpreted completely different than, hey, yeah, it'll take a few weeks, but we can get you back to normal.
Yeah.
Two totally different patients.
Yeah, and I totally empathize with people that have had long-term pain because it's hard to keep that optimism
Yeah.
when it's been so long. But all I can say to those people is your mental outlook on it has everything to do with your ability to recover from it, and don't devalue the ability for your mental state to change physical factors, right? Like when you have the right outlook, it will physically change the nerve pathways in your body. Because if you've been dealing with chronic pain for a long time, the tissue damage is already done, right? You're not still in a place of tissue injury necessarily.
Yeah.
You're in a place of these nerves, for the most part, unless it's a repetitive reuse injury, right? But for the most part, these nerve pathways are sensitized. They're used to being used because you've focused on them. You've emphasized them cognitively. I know this is kind of an elusive topic, but you've reinforced that pathway and it continues to exist. When you change your mental outlook and you start using different nerves in your brain, the emphasis changes, the focus changes, and you can eliminate those pathways and make new healthy ones.
Totally agree. I see it in patients, sometimes, especially with chronic disease, after a diagnosis, you see patients either, stay positive, do what they can to control something that's, partly out of their control, and then you see some patients that are very negative, and of course that affects everything else, and they won't do as well. I also see the opposite. Like I remember this patient very clearly years ago who had ankylosing spondylitis, and initially after the diagnosis, he was really struggling with pain. He stopped all of his activities, couldn't sleep. Like he kept telling me, I imagine myself in a wheelchair in a few years. I don't know what's gonna happen to me. I can't sleep. It's too stressful. My back is always painful. And then I didn't see him for several months, and then he came in and his entire outlook had changed. And I said, what happened? He said, well, I basically realized that I have this problem and I can either choose to focus on the problem and on the pain because of the problem, or I can try to live my life as normally as I can despite this problem. And that shift for him was very significant. And just like you were explaining, in terms of his ability to cope and maintain his activity, and even if the condition or the medication hadn't changed, his functioning really improved simply because of his outlook had changed, was more positive.
Yeah, and that brings up a great point that I wanted to kind of bring up with you. And so obviously we have the issue of people maybe not accepting, not recognizing they have an issue and therefore not seeking help. But conversely, people that recognize or are told that they have an issue, a mental health issue, and take that on as their identity, and it therefore is part of them and how they view themselves, and that can be very destructive as well.
Again, I agree that can happen for sure. I see patients all identify to their disease and they basically become their condition. And I agree that that's not helpful, obviously, right? Like if you start considering yourself a depressed person versus someone that's going through depression,
right,
it's not helpful. And that's usually where the counseling will help. One of the key things that cognitive behavioral therapy tries to do is to put everything into perspective, right? Like, what is the worst case scenario, and what's likely to happen, and how is this truly affecting your ability to live in the world, basically, and breaking down those unhealthy thought patterns. But obviously, when someone has anxiety or depression, it's because there are unhealthy thought patterns. Like the person is stuck, just feeling that things are worse than they are usually. Because otherwise, depression is really sadness. Sadness is a normal part of life. It's normal to grieve if you've lost someone you love. But it's not normal to feel sad and depressed for years. And so when that's happening, it's usually a sign that we need better coping strategies. We need to re-educate the brain. We need that person to be more critical of those unhealthy thoughts that they're having that are sabotaging them, basically. but yeah, I see that all the time too, where someone starts to feel like they're never going to get through it. But the bottom line is that those conditions, depression, anxiety, mental health issues, most of them are highly treatable. The problem is a lot of people don't seek treatment. So with anxiety, less than a third of patients are getting help, and we know that if you don't treat anxiety, it usually gets worse. And from anxiety, we can go into depression, and then of course the worst case scenario is that we end up with someone that has suicidal thoughts because the anxiety wasn't treated when it should have been addressed.
Yeah, and glad you brought up the fact that people have anxiety and they go, well, I'm not going to deal with it right now. It's because of COVID, or what? It's because of this, or it's because of whatever.
Yeah.
And typically, what you'll find, I assume, is they get out of that external thing. You know, COVID's over, whatever. But those mental health issues persist, right?
Not always, but yeah, for lots of people that's the risk, right? Like you've been stuck in this thought pattern and it may not resolve simply because, you know, the pandemic is over. Some patients feel better as soon as they're able to see other people. Like I see that a lot where, especially now with the vaccination, like I have patients now that have received both vaccines and feel more comfortable being around other people, and you see significant gains in terms of how they feel. But I also have other people that are now so scared to go out and to be exposed to others that I do think they need help to basically get over that stress, over that anxiety, and return to their pre-COVID lives, for sure.
That's a great point. Like I do feel like people are somewhat afraid to like return to normal and be like around other people. Like, you know, they're talking on the radio this morning about potentially having no masks for like Stampede or for like most of July, and it's like, okay, well, who's still gonna wear a mask? Like seriously, even if you're vaccinated, like you're around other people, like that's something we've strayed so far from in the last year and a half. How do you think you could maybe help people get over that hump and kind of be like, okay, it's normal, I'm safe, I can see people, like things are good again? Because we do need to reintroduce that, but people are naturally going to be hesitant, right?
Yeah, I think a lot of people are going to be scared for sure. I think it'd be the same as if all of a sudden we told people, hey, you don't need to wear a seatbelt anymore.
Exactly.
Like a lot of people would be like, well, I don't feel safe, I'm not wearing a seatbelt.
Yeah.
But typically it's, in those types of cases, it's desensitization, right? So it'd be the same as someone that's really scared to take an airplane. So
Right.
what would we do with them? Well, we take them to the airport and
Just
then
show them the airplane.
show them the airplane, let them sit on the airplane, then they would take them for a very short flight, like 10 minutes in the air, come back, talk about it, understand what are the thought patterns that are happening for that person. So with the mask, I would say, you know, at first maybe if it creates anxiety for you to remove the mask, then maybe at first remove the mask when you're outside, further away from people, and then maybe don't wear a mask if you're walking with someone you know, and then slowly go from there. But you know, go at your pace if that's what you need to do. But wearing a mask for the rest of your life is probably not the best strategy in terms of social interaction and, you know, all those things that we haven't had for the last few years, right? Like not being able to see facial expressions, and the mask is definitely a barrier when it comes to feeling close to someone. So but I think we will see some anxiety from that for sure.
For sure.
Yeah.
And I think that's just a good reminder, a good example that gradual exposure can be a very powerful tool to overcome whatever fear you may have.
Yeah, the worst case scenario would be to never confront that fear, right? Like I have patients that are scared of elevators, but they haven't been in an elevator in 30 years. So now it's impossible to get them in an elevator.
Seriously,
yeah. But the strategy should have been initially, okay, I'm scared of elevators. I know it's not a rational thing. I know I'm not gonna run out of air in an elevator. And then to seek therapy, to have someone that helps you get better coping strategies, and then slowly re-expose yourself to elevators. And otherwise you're condemned to the stairs for the rest of your life, right?
Yeah.
Yeah,
That's
and
not bad either, I guess, if you're trying
Well,
to
in this case, yeah.
exercise.
Yeah, it depends where you work and where you live, but I can tell you there's some people for whom it can become a real problem.
Yeah.
That's interesting. I mean, just talking about the exposure therapy type thing, that really is just another way of framing things, you know? It's like, okay, there's the elevator at the end of the hall. What's the worst thing that's gonna happen? Nothing. And then they walk up to the elevator and they're like, okay, like, still nothing. Like, there's nothing bad is gonna happen. And it sounds like a really ridiculous kind of example to use in this specific context with like elevators, but like, really every moment of your actual everyday life is like that. You have to frame it. You have to be like, is this dangerous? Is this something that's going to help me? How much should I react to this? How much should I be exposed to this? Like, it's all about the way you interpret things, the way you frame things, for sure.
Yeah,
Absolutely. Yeah.
absolutely, and that can be in a social setting or
Or anywhere.
speaking publicly. Applied to anything really.
Applied to anything and everything.
Yeah.
So as a kind of closing statement, I just want to give everybody a good idea as to when it might be a good time to approach a naturopath for these type of issues, when you guys are probably best suited or a good option to address these, or when it might be a good option to look at a psychotherapist. Any
Great
closing
point.
statements there?
Yeah, I think honestly most of us should have a talk therapist that we can see whenever we need to, just like I think most patients should have a family doctor if they need to see one. I think being more aware of those issues is an important thing. I think if someone feels that they're struggling, the most important thing is to ask for help. But unfortunately with mental health, that often does not happen. People feel ashamed to have those issues and they don't want to talk about them, and then the problem never gets addressed and doesn't get resolved and slowly gets worse. So, if you feel depressed, if you've lost your motivation to do things you would normally enjoy, if you are always or often sad, if you have stress, anxiety, and fear to an extent that it starts affecting your day-to-day life functioning, your work, your sleep, you need help and you should seek help, and there's nothing wrong with that. I think not seeking help is actually what should be criticized. Like I really do think that most of us at some time in our life will struggle with those issues. Depression is one of the most common conditions that affects humanity overall. They say about 10% of humanity suffers from depression at any given time. There's nothing embarrassing about having those problems. You just need to get on top of them, just like you would address any other medical condition that you would have. And with expert help, those problems are highly treatable, and they're devastating. There's devastating consequences to being in poor mental health. It increases the risk of suicide. It affects personal relationships. Those problems need to be addressed. Naturopathic doctors, I think, offer a lot to those patients when it comes to looking at lifestyle. It's one of our areas of expertise, and then looking at barriers as to what's happening that's preventing people from having healthier lifestyles that support better mental health. But typically I would work in conjunction with a talk therapist. So I would tell the patient, I want you to see a psychologist that will help you in terms of sifting through those emotions and understanding the thought patterns.
Yeah.
Where my role comes in is more giving nutrients that help to support normal neurological function, neurotransmitter function, and then looking at lifestyle, like making sure that person is exercising, that they are fostering healthy relationships, and that they get proper nutrition, proper rest. All those things are important. When it comes down to it, it's a lot of discipline, right? Just like exercise and other aspects of overall health, mental health, I think unfortunately society focuses a lot on medication right now when it comes to those problems, but a lot of those problems are more related to lifestyle and things we do day in, day out, and that's what we want to address, right?
Totally. And I agree, it is a lot of discipline, but the great thing about having an expert like yourself in your corner is, let's find out where to direct this discipline. Because it's hard to be disciplined when the goal isn't clear, you don't know where the finish line is, no one's broken it down for you, and you're not completely self-aware until you've talked to somebody.
I
right?
totally agree, and I see that often where patients are focusing on the wrong thing, right? It's
Yeah.
sometimes the thing that they decide to do to try to help themselves out of those situations is not going to be the most effective approach.
Mm-hmm.
Yeah, so that having that objective, independent expert that can say, what would help you the most right now would be, better sleep or more exercise or these supplements. Yeah, that can be very useful, obviously.
All right, well, thanks for coming on, Dr. Brunel here. We appreciate going through this. We hope to have many more podcasts with you. Dr. Alex, always an
Always a
absolute-
pleasure.
Yeah, always.
Thank
Good
you very
stuff,
much.
Dad. And thanks to all our listeners. We appreciate you guys tuning in. We hope this podcast kind of served as a reflective, maybe introspective process for you, where you can take a look at yourself and go, hey, maybe this is something I should think about, maybe something I should approach someone about or get expert advice. And really what we try to do here is have people prioritize their own health as something to consider, something to address, because when your health is in line, everything else kind of falls into place. So that's the goal for us. And thanks for listening.